Hi, my name is Terp Barron, and today I'll be discussing Indigenous children in the United States, their history, the systemic inequities they face, and evidence-based pathways towards healing and empowerment. First, I'd like to note that I live, work, and wrote this presentation in Decatur, Georgia. Decatur is the ancestral home of the Muskogee Nation, and in 1821 they were forcibly relocated to Oklahoma with the Cherokee Nation on the Trail of Tears. The Muskogee Nation is a vibrant and living nation, and I encourage all of us to look into Indigenous-led movements to restore justice and equity for Native peoples. I'd also like to talk about language. I used a lot of government resources for this presentation, and American Indian and Alaska Native, AI, AN, tribes, tribal, tribe are all government terms. American Indian and Native American may not be ideal terms as they were coined by colonizers who believed that they had landed in India, and many indigenous nations do not consider themselves Americans. But there is also no consensus on this. Indigenous culture is not a monolith. Many are okay with and use these terms, and many are not. Throughout the paper, when possible, I will use the terms Indigenous and nations and First Nations when possible in general respect for the sovereignty of the First Nations of this country. Indigenous people are a complex and often misunderstood demographic. In our culture, they are often celebrated and lauded for their art and culture. We all love to see the regalia and the dances. But their history is really not accurately taught in our schools, and we often don't really know what truly happened. The United States is home to federally recognized 574 tribal nations, and their culture is not a monolith, but there are some common threads, which include connection to land and nature, communal and family-based living. We talk a lot about how Western counseling is very individual-based, Western thought is very individual, and Indigenous people tend to be very community-based. And there's a lot of spirituality, but not necessarily religion. The spirituality tends to be tied into the land and stewardship practices. There's less religious dogma in these communities. Indigenous people continue to live with the effects of colonization, displacement, and cultural erasure, as well as systemic underinvestment. The most current census reports 7.4 million people in the United States identify as American Indian or Alaskan Native. American Indian and Alaska Natives make up 3.5% of the United States child population, and the population is overall young and growing, with 30% of that population being under 18 in this community having a higher than average fertility rate than other groups. So the myth of the disappearing Indian is completely false. In 2021, the high school graduation rate for American Indian students was 74%, which is significantly lower than the national average for all other racial and ethnic groups. American Indian and Alaska Native youth also have the highest suicide rate in the country for their age group, and suicide is the leading cause of death for American Indian and Alaska Native minors. AIAN youth experienced 25% of contemplated suicides, 20% of planned suicides, and 18% of attempted suicides among minors in the United States. AIAN youth also disproportionately live in poverty. 27% of AIAN families with children live in poverty, and that number rises to 32% if the child is under 5 years old. This is more than double the rate of the general population. AIAN youth are also disproportionately at risk for SED, PTSD, and other mental health disorders. So understanding where these struggles began requires a lot of historical context. Let's begin with the Indian Removal Act. First, we need to understand that land is central to Indigenous identity and spirituality. Losing their connection to the land is basically losing identity. It's losing connection to the ancestors, it's losing stewardship practices, it's losing the core of their spiritual beliefs. The Indian Removal Act of 1830 and subsequent relocation of Indigenous people from their ancestral lands was an attempt at assimilation by the U.S. government, but it was also a gross reallocation of resources. It's harmful in several dimensions. They lost their culture, lifestyle, and they moved entire nations to new lands, which were typically at least 150 miles away, which often presented new climates and vastly fewer natural resources. change their agriculture, diet, and remove spiritual and cultural ties to ancestors and ways of being. Relocation was also not merely relocation, it was theft. The amount of total landmass lost is near total at 98.9%. Also, not all nations were given individual, government, or federal recognized land. Many were forced to share lands with other displaced nations. This is definitely the case in Oklahoma, which hosts the most reservation land and was a mixing pot of tribal nations. Mixing these nations, which were typically culturally dissimilar, led to more dilution and loss of culture and language. Another part of Indigenous history we truly need to bear in mind and understand is the history of the federal Indian boarding schools. Between 1819 and 1969, 417 of these schools were federally opened and operated, and this number does not include other schools that were operated by religious institutions or private institutions that operated under the same pretext. The motto of these schools was to kill the Indian, save the man. At these schools, children were renamed with English names, their language was banned, as was their clothing and ceremonies, their hair was cut, and any infractions against these rules were punished severely with corporal punishment, which included denying food, solitary confinement, flogging and whipping, and more. They often made their classmates enact these punishments, which created a cruel hierarchy within schools, and it further eroded those cultural ties. These schools, similar to the reservations, also held dozens from dozens of nations, which created the same language and tradition dilution. Education consisted mostly of manual labor that would be useful to the U.S. economy, including agricultural practices, animal husbandry, and garment making. You'll notice that these are not high-paying jobs that they were being trained for. They were also all taught in a Western tradition that, again, alienated them from their cultures. Western farming practices are very different than Indigenous farming practices. Attendance at these schools by Indigenous children was compulsory, and noncompliance was punished by withholding government-sponsored aid and rations, which were necessary given that the government stole 98.9% of the land and resources, making farming enough food and being self-sufficient impossible for these nations. Perhaps most shockingly was the level of abuse and death present at these schools. An initial investigation by Deb Haaland, the first person of Indigenous descent to serve as Secretary of the Interior, was launched in 2021. This was only launched for the federal schools. 973 confirmed child deaths were found, and there are more that are likely have been undiscovered. And currently known are 74 burial sites among 65 school locations, 53 marked and 21 unmarked. Again, this is likely an incomplete number, and this is only the federal schools. The religious schools and the private schools are uninvestigated. It's important to know, as I am discussing these things, that this is really just the surface level of what happened. These schools were only investigated starting in 2021, and the investigation is not truly complete. So if this is what's been reported, it's likely that much worse happened, which is important to remember when we're talking about what's going on at home presently. Parents and grandparents who survive the residential schools have high instances of PTSD, substance use disorder, and other mood disorders. They also exhibit lack of cultural identity, attachment difficulties, and self-isolation, and this has impacts on their children and grandchildren. Children and grandchildren of these survivors are often more sensitive to perceived discrimination and racism. They show higher levels of psychological distress and suicidal ideation. They are also disproportionately likely to witness or experience domestic violence and substance use disorder in the home. As noted earlier, AIAN youth have the lowest graduation rate and unemployment ranges on the reservation system from 14.4 to 35%, partly due to education barriers as well as geographic isolation from well-paying work. 14% is significantly higher than the general U.S. population, even in the worst recession. And going back to the previous statistic about poverty, 27% of families with children live in poverty, and that number rises to 32% if the child is under 5 years old. This is more than double the rate of the general population. So there's a lot of adverse childhood experiences going on with these kids. Low graduation rates are likely partly that these schools are under-resourced, but also the schools just don't provide a supportive environment for Indigenous kids. Students report regularly hearing racial slurs. They receive harsher and more frequent punishments than other kids. And they feel like the curriculum is really just an extension of the residential schools. They don't celebrate their culture. They don't tell the true history of their nations. And they're being asked to submit to indoctrination that is similar to what they were learning in the residential schools, that their history doesn't really matter the way it does to them. Um, Also, the amount of cultural appropriation is very disturbing to these kids. Think about sports mascots, think about Johnny Depp playing Tonto in The Lone Ranger. It's the way their culture is appropriated and celebrated for fashion purposes, often very sacred garments are appropriated for fashion purposes, as they are being culturally erased is very disturbing. Access to care, both general health and behavioral health, is also a problem. Healthcare for First Nations peoples is guaranteed under treaty in exchange for tribal lands, and since 1955, the Indian Health Service has been providing that care. IHS is chronically underfunded, even though this population does have disproportionately high levels of chronic disease, diabetes, heart disease, and mental health disorders. IHS, unlike other services, is funded through discretionary funding and is prone to lapses of funding due to government shutdowns and economic turmoil. The per capita spending is also very low. In 2017, per capita was $4,078 compared to Medicaid, which was $8,109, and the VA, which was $10,692. The figure for IHS includes contributions from Medicaid, so some of that Medicaid money went to IHS. There is also low engagement with IHS. IHS does employ 50% American Indian and Alaska Native people, but there's a lot of distrust of it because it is government provided healthcare, and often providers work solely from a Western model that does not incorporate Indigenous culture and beliefs. So there's very low trust in that system. So what have we learned so far? The common thread among all these factors is the legacy and perpetuation of colonization and cultural erasure. It is clear that any interventions that we want to implement to help Indigenous children must be extremely culturally sensitive and integrate a thoroughly trauma-informed and historically informed framework. We also must work in collaboration with the Indigenous peoples that we are intending to serve. Let's talk about an educational intervention, Montana's Indian Education for All Act. This was adopted in 1972 into the Montana Constitution and made a promise that all public school students would receive some kind of education about their Indigenous history. That still had not really gone into effect in 1999. They had to pass a law which underscored the state's commitment to this. And frankly, it's still not happening in all schools. This is something they're still fighting for. However, there was a pilot program in a middle school that went really well, so let's talk about it. Indigenous parents worked with the teachers to develop a curricula that was inclusive of Montana's Indigenous heritage, both historical and contemporary. That curricula had to be very holistic. It wasn't just about the past, it had to include what's going on now. So that includes the 12 tribal nations that reside in Montana, as well as their diverse languages, cultures, and governments, a framework for understanding tribal sovereignty, conceptualization of Indigenous identity on a continuum from traditional to assimilated, rather than purely on genetic ancestry, which gets muddy. There were sections on Indigenous spirituality and ways of thinking, the origin of the reservation system, and the history of government relations and interference with Indigenous peoples from an Indigenous perspective. They conducted a randomized trial in which students randomly received instruction with varying levels of inclusion of the curriculum, and it showed that students that received more of the curriculum, both Indigenous and not, had overall improved attitudinal outcomes, improved self-esteem, and cultural identification. For the Indigenous students, it really affirmed their cultural identity, which is important. That's linked to good mental health outcomes. And the attitudes of non-Indigenous students and faculty towards Indigenous students improved, which decreased instances of racism. Similar mandates could be undertaken regionally to bridge gaps in cultural and educational understanding in schools nationwide. Okay, now let's talk about an intervention for substance use disorder. There is a concept, two-eyed seeing, that was introduced by Mi'kmaq elders Albert and Mardana, which is a method of combining Western and Indigenous thought, seeing the Indigenous way of knowing through one eye and the Western scientific way through another eye, and seeing through both eyes to get the best of both. This perspective is especially helpful in healthcare settings where the trust is low because the Indigenous perspective is not typically considered. A model of treating substance use disorder and intergenerational trauma, both of which disproportionately affect Indigenous youth, was developed and tested from this two-eyed seeing approach and implemented in treatment centers in Canada. The model blended an existing framework, Seeking Safety, which is a Western substance abuse and PTSD treatment model. It treats both. And it integrated Indigenous healing practices, including sharing circles with elders, storytelling, smudging, drumming, tobacco offerings, and sweat lodges, into a new model named Indigenous Healing and Seeking Safety, IHSS. This was modeled for both facilitators and clients, and qualitative interviews indicated higher Indigenous patient engagement with the program, an increased sense of safety and understanding, and a greater sense of healing. They were more willing to actually do the program because it integrated what they believed in. This is a powerful evidence-based case study for combining Western practices with Indigenous spiritual practices and community involvement in order to provide culturally appropriate care. And for our last case study, we're going to look at a program for suicide prevention. Suicide is a leading cause of death for Indigenous youth, and Indigenous youth rarely seek help during a suicidal crisis. Only 10 to 35% do. And when they do, they prefer to seek help of family or community members rather than mental health professionals. This is going back to that idea that we don't necessarily trust government healthcare or Western healthcare. This is a lot like the last example where we integrate two-eyed seeing, this IHSS model, on top of a existing Western model. So one Alaskan town, they did not want to be named, this nation did not consent to being named in the study, used the Adolescent Suicide Prevention Project model, which already included community outreach interventions outside of healthcare settings, kind of ongoing data and information gathering on at-risk youth, social services, and school integrated units on life skills and psychoeducation. So there's already this really good framework that works with this community where they're in the community, they're not in a healthcare setting, you're working with teachers, you're working with families. In collaboration with IHS, this tribe modified it for their community by having the social workers come and train volunteers in the community to be natural helpers, basically peer guides who could provide immediate help to their neighbors, check on their students, check in on their community members, and they would refer to mental health services when needed. But in the meantime, it provided a good training framework for these kids to turn to their community members that they feel more comfortable with. They were also able to provide guidance and mentorship in outdoor environments, which clients found to be more comfortable than healthcare offices. So this really set them up for success because rather than feeling pressured to go talk to the social worker at IHS, they could go talk to their auntie, they could talk to their neighbor, they could speak somewhere where they feel comfortable, and that neighbor could provide a safe framework for engaging with the social worker who could then, again, come speak to them where they're comfortable, not in the healthcare office. This program was targeted to children aged 11 to 18, and over the 14-year course of the program, annual averages of suicidal gestures and attempt dropped from 15 and 19.5 respectively to 4 and 4. Success in the program has been attributed to community involvement at all levels, as well as youth being more comfortable seeking help from their community members and cooperating with mental health professionals when referred by and being supported by their community. From these case studies, we can see that interventions that integrate and collaborate with Indigenous communities are proven to be the most effective for Indigenous youth. Where Western culture tends to elevate the individual and logical, integrating Indigenous values of community, interconnectedness, and spirituality increases trust in participation and helping models, increasing wellness outcomes, and promoting movement towards healing. Thank you for watching my presentation. I welcome any questions or comments, and my references are on the next slide.